how the dementia patients will look like. Like we separated it into, we classified it into early, middle, and late, and we discussed according to this. You know why I have categorized this as gait and mental ability and other motor functions, physical activity, because depending upon that only we can go for a framework for assessment. Okay, for dementia patient, you know very well, for upper motor neuron lesion or lower motor neuron lesion, whatever it may be, you will assess upper motor neuron or lower motor neuron. You will go for Babinski sign or whatever it may be, whether it is how it is classified into UMN or LMN. You have to classify, afterwards you will go. But here it is dementia. It is more of, so how will you classify? What are the things we can assess? That we have to understand. So initially we have to understand what are the things first we are going to assess. Point is, we have to assess mental ability, right? Right? Physiotherapy assessment, that means the screening for the physiotherapy assessment. What are the components should be there inside? First thing, the screening must be for mental ability, right? Of course, for physical ability, physical activity, it will be also reduced, right? So physical activity, right? Any other thing? Any other thing? Okay. Mental ability, particularly about memory. Right? Then gait. At least these three we have to do. Physical activity means, I am saying about the combination of everything. Simple task to complex task. Everything. Simple flexion of elbow, that is simple task, to complex task, like taking up the coffee, taking the pen, writing a letter, or doing some activity, small activities like. So simple to complex, I am adding everything. So physical activity, mental ability, like say, okay, here mental ability of the patient for dementia is actually done with, we have many scales, actually. COVA scale is there, but anyway, simple and easy scale is mini mental state evaluation scale. Mini mental state evaluation scale. That means this scale will be having many questions. Many questions in the sense, at what time you woke up, what did you have for the breakfast, what color you like, and at what time you would like to go to bed, and how many times you have this, like this small things. Can you wear your shirt, like that we can ask. The patient will be wearing, and how far he is doing finely, how many buttons he is able to do that, whether he is able to concentrate on the buttons, because sometimes they will concentrate from here, they may not concentrate from here to here, because it is not easy for the vision, so they will not concentrate. Like this, small things will be there. And there are many other some timing sensation also. So, timing attitude, like small things, time, about place, some things will be there. All these things will be there, and we'll be asking the question, they will be giving the answer, and we will be marking. From that we will analyze how far the mental ability is there. What about their memory, how long they can remember, like that you can understand certain things. Okay, then if you want, you can go for any other skill, but this one is so simple, and when we are using this, we can easily classify the stages of dementia, whether it is in the last stage or middle stage or early stage. We can easily classify because the usage of numbers and the other physical activities is according to that, very easy. Okay, then physical activity means, for example, there are certain tests like tug test. What is the tug test? Time up, go. Time up go means simply we'll making the patient like this, stand like this. I'll tell you, I will count for 5. 1, 2, 3, 4, 5. After counting 5, I'll say go, and you have to go. Like that, we will instruct the patient. The patient will be standing like this. Okay, 1, 2, 3, 4, 5. The point is, when we are counting, this is a simple task, or else they can sit. Okay, we can ask the patient to sit here, sit, and I'll count for 5, and you have to get up and go. Like this we have to say. The point is, when we are counting for 5 seconds, whether they are being able to concentrate on us, whether they are able to hear what we are speaking, they understood, right? We have to wait for 5 seconds. If they completely understand only, they will wait for 5 seconds. Otherwise, in the middle, they will get up and go.